Ancient Egyptians, however, developed a more nuanced understanding. They recognized the connection between the mind and body, attributing mental distress to imbalances within. Their treatments included herbal remedies, prayers, and therapeutic baths, demonstrating a surprisingly holistic approach. Ancient healer. In ancient Greece, physicians like Hippocrates challenged the prevailing supernatural beliefs. Hippocrates proposed that mental illness stemmed from an imbalance of bodily fluids known as humours. This theory, while flawed, shifted the focus from the supernatural to the physical, paving the way for more scientific inquiry. Despite these early attempts at understanding, mental illness remained shrouded in fear and misunderstanding for centuries. Treatments remained largely ineffective, and those suffering from mental illness were often ostracized and feared. The Middle Ages saw the establishment of the first institutions specifically designated for the mentally ill. These early establishments marked the beginning of a long and often troubling history in the care of those with mental health issues. These early asylums, however, were far from therapeutic havens. They were more akin to prisons than places of healing, where the primary goal was to remove the mentally ill from society rather than to provide them with care. Often housed in former leprosariums or monasteries, these institutions were characterized by deplorable conditions. The buildings were old, damp, and poorly maintained, contributing to the suffering of the patients. Overcrowding, poor sanitation, and a lack of proper care were rampant. Patients were crammed into small spaces, with little regard for their comfort or dignity. The lack of hygiene and medical care often led to the spread of diseases, exacerbating the patient's conditions. Patients were often chained, physically restrained, and subjected to cruel treatments such as bloodletting and purging. These methods were not only ineffective, but also caused immense physical and psychological pain. These practices were based on the prevailing belief that mental illness stemmed from physical imbalances or moral failings. The medical understanding of mental health was rudimentary at best, and treatments were more about control than cure. The Bedlam Royal Hospital in London, known colloquially as Bedlam, became infamous for its inhumane treatment of patients. The name Bedlam itself became synonymous with chaos and madness, reflecting the public's perception of mental illness. Visitors would pay to gawk at the residents, further dehumanizing those suffering from mental illness. This practice turned the suffering of individuals into a form of entertainment, highlighting the lack of empathy and understanding in society. Bedlam became a symbol of the fear and misunderstanding surrounding mental illness during this period. The stigma associated with mental health issues was deeply ingrained, and those affected were often ostracized and mistreated. The Renaissance brought about a renewed interest in humanism and scientific inquiry. Thinkers began to challenge old beliefs and sought to understand the human mind in new ways. However, these advancements did not immediately translate to improvements in the treatment of the mentally ill. While there was a growing recognition of the need for better care, the actual conditions in asylums remained largely unchanged. Asylums continued to operate as places of confinement rather than healing, perpetuating the cycle of fear and neglect. The journey towards humane and effective mental health care was only just beginning, and it would take many more years of advocacy and reform to bring about meaningful change. The 18th century witnessed a gradual shift in attitudes towards mental illness, fueled by the Enlightenment's emphasis on reason and individual rights. This period, often referred to as the Age of Reason, brought about a profound transformation in how society viewed and treated those suffering from mental disorders. The Enlightenment thinkers began to challenge the long-held superstitions and inhumane practices that had dominated mental health care for centuries. Thinkers like John